Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube, and the audio is available on Wisconsin Eye. Before opening remarks and your question, a reminder to maintain quality audio, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-Designee Andrea Palm, and available to answer your questions are Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestun, the Chief Legal Counsel for the Governor's Office. We will begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thank you for joining us. Today, I want to take a moment to thank you for help keeping your families, our neighbors, and our communities healthy and safe by staying home. Safer at Home is working, and while we're not just out of the clear yet, I am proud of the work each of you are doing and doing for yourself and for your part to help prevent the spread of COVID-19 in Wisconsin. Last week, we announced we would be extending our Safer at Home order, which will go into effect tomorrow, Friday, April 24th. According to a new poll released from the Associated Press and NORC, 61% of Americans feel the steps taken by government officials to protect folks from COVID-19 are about right. And the good news is that our Safer at Home order is much less restrictive than many other states across our country. Under our new order, you still can go out and take a walk, go for a bike ride, or walk the dogs. It's good exercise and it's good for everyone's mental health. But we are still asking you to limit your unnecessary trips, limit your travel to essential needs like going to the doctor, grabbing groceries, or getting medication. And although we're still encouraging folks to stay safer at home, our new order also includes some important changes and flexibilities. Starting tomorrow, our public libraries will be able to provide curbside pickup of books and other materials. Arts and crafts stores may offer expanded curbside pickup of materials necessary to make face masks and other personal protective equipment. And yes, starting tomorrow, golf courses may open up, which I know folks across our state have been asking for. You'll just need to schedule and pay for your tee time over the phone. As I've often said, getting back to normal won't be like a light switch. We have to think of it like turning down a dial. We're continuing to look at additional flexibilities to be able to turn the dial down before May 26th. And in the meantime, we'll all have to keep doing our part so that our families, our neighbors, and our communities are safe. In addition to all the folks who are staying safer at home, I also want to thank all the folks who have signed up to volunteer through our Wisconsin Emergency Assistance Volunteer Registry, or WEAVR, to help support our healthcare workers and systems across our state. In the two weeks since we announced WEAVR, more than 3,000 people have registered to volunteer. These folks will allow us to provide support to communities such as the 25 people who were recently referred to Racine County to help with local staffing needs. So thank you to all the folks who signed up to help. If you're interested in volunteering, we still need both clinical and non-clinical roles, from physicians to CNAs to social workers to respiratory therapists. You can get signed up today by visiting WEAVRwisconsin.org. Finally, I also want to thank some of our partners across our state who are helping make sure that we have enough personal protective equipment to be able to respond to the spread of COVID-19 in Wisconsin. Direct Supply is providing their expertise with our State Emergency Operations Center, providing logistics and warehouse support. ND Paper, which also has a plant in Wisconsin Rapids, generously donated 20,000 face masks and 1,500 isolation gowns. Foxconn has donated 100,000 medical masks for our COVID-19 response. Wisconsin's Kohler Corporation has provided 10,000 face shields and is using its supplier network to identify additional personal protective equipment donation opportunities. Thank you all for your good work in helping support our state during these difficult times. And Wisconsinites across our state who are continuing to stay safer at home, please keep up the good work so that we can turn the dial down as soon as we safely and responsibly can. And with that, I'll turn things over to DHS Secretary Designee Andrea Palm.
Good afternoon, and thank you for joining us again. As the governor pointed out, Safer at Home is working, and we need to all continue working together to turn the dial to start opening up our state in phases. We are doubling down on the Badger Bounce Back plan to test every Wisconsin resident who needs a test, to trace every positive case and their contacts, and to track the spread of the virus. As we continue to make progress with more and more testing available, we are also working to increase our contact tracing capabilities. Contact tracing is a phrase that may be new to some of you, but as with many other things about this pandemic, is becoming more and more a part of our lexicon by the day. And as a fundamental tool, we need your partnership to effectively utilize in our efforts to contain the virus until there is a vaccine or other effective medical treatment. I'd like to take a moment to explain it a little more fully. When a COVID-19 test comes back positive, the local public health department is notified. At that point, a public health worker from that department calls the individual with the positive test result to interview them. During the interview, the public health worker will ask questions designed to identify other people who may be at risk of infection. Then, these at-risk people are notified of their exposure to COVID-19 so they can self-isolate to avoid spreading the virus any further. It's important to understand that no identifying information about the individual who tested positive is shared in these follow-up calls. The calls are critical notification and also provide information and tools for the at-risk person so they can take the necessary steps to stop the spread of the virus. As we build up our testing and contact tracing capacities and start to turn the dial, more Wisconsinites are going to receive calls from their local public health contact tracers. Just as you continue to be excellent partners in flattening the curve through Safer at Home, we will be asking you to answer that call and to engage in local contact tracing efforts to help us stop the spread of COVID-19. So now I want to give you an update on our numbers for today. Here's where we stand. We have 48 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 10,937 tests. We have 51,456 negative tests, which is an increase of 1,954 over yesterday. There are now 5,052 confirmed cases of COVID-19 in Wisconsin, an increase of 207. Our deaths now total 257. Thank you for continuing to do the important work of flattening the curve and for your partnership on Badger Bounce Back to help us get ready to turn the dial.
Thank you. We'll now open it up for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time for your question. And in the interest of time, please one question per reporter per media outlet. We'll begin today's questions with Mason Dowling from WAOW TV in Wausau. Mason?
Yes, hi. Can you hear me?
Yes.
Perfect.
Yes.
Thank you for taking this call. This question is for Governor Evers. I understand that you signed an order to have a new testing site set up in the state fairgrounds earlier today. My question is this. A lot in our area, central Wisconsin, hospital systems are having to furlough and lay off workers because they're not seeing really any cases and they're just kind of in standby mode. How are we going to be helping the central Wisconsin or just across the areas not impacted in their hospital systems?
Yeah, so the governor and I did sign an order today for an alternate care facility on state fairgrounds, and I do think this is a place where Safer at Home and flattening the curve is really showing evidence, is part of where we're really seeing evidence that it's working, because to your point in your question, the capacity of hospitals has not been really tested or exceeded, but this alternative care facility will allow us to continue to turn the dial, to move forward, to be able to have the capacity that we need should we see a surge in the future. And as it relates to the capacity of systems more broadly across the state, I would say that one of the things we're very interested in making sure we are doing in partnership with hospitals who have the total discretion about how they do this, but some of this deferred care that is happening because we have been in a situation where we are trying to preserve all the capacity of our hospital systems for a surge in COVID-19 cases is building up this testing capacity, building up our PPE supplies, continuing to make sure that we are doing everything we can to ensure that frontline healthcare workers have the kind of PPE they need to serve patients in their systems, and those additional tools and capacities will really help bolster local hospital systems' comfort about starting to return to doing some of that deferred care, and that in turn will allow many of those folks to start going back to work in their healthcare systems. So it's part of the bigger picture for us. It's a piece that we are very interested in making happen as quickly as we can, recognizing that we continue to see PPE shortages here and around the country.
Thank you, Mason. Now to Monique Lopez from WLUK in Green Bay. Monique?
Yes, can you hear me?
Yes.
Great, thank you. This question is for Governor Evers. So the phase one of the Badger Bounce Back Plan allows K through 12 schools to reopen, but only the gatherings are still up to 10 or restricted to 10. Those just seem to be contradicting. They seem to contradict themselves, especially because most classes, even summer school classes, would have more kids. So how is that going to work?
Sure, I can answer that question for the governor. So in terms of phase one with the Badger Bounce Back order, it lays out areas that a new order would address. And like you said, it would have a 10-person mass gathering ban, and it would also allow K-12 schools to reopen. The thing to keep in mind is stated in that order, is that additional specificity will be provided to address some of the issues that you identified. What we wanted to do with the Badger Bounce Back plan was be able to provide some direction and guidance so the public knows where, once we meet these really critically important metrics in terms of having a downward trajectory on the number of people who are test positive for COVID-19, in terms of having sufficient hospital capacity and PPE, is that people know what to expect in phase one, but that will be delineated further to address, to make sure that schools can safely reopen, knowing that while they will reopen, it won't be how they were in December 2019, for example. There'll be measures in place while working with stakeholders, working with teachers, working with administrators to make sure that school can reopen, but it can be done so in a safe manner. And, like most things in public education, there'll be a lot of local decision-making that will need to occur.
Thank you, Monique. Now to WKOW TV in Madison. WKOW. Okay, we'll move on then to Brendan Cullerton at CBS 58 in Milwaukee. Brendan?
Hey, can you hear me?
Yes.
Question for Governor Evers. With yesterday seeing such a sharp increase in cases, did that make you reconsider loosening these restrictions at all? And might those restrictions come back if we see more days like that?
Well, as you know, certainly you're always concerned when you see large numbers, but also keep in mind that the metrics we're using to move our system forward is per the number of tests. Now, I don't know how many tests were part of this 207, but clearly, if we use that, frankly, in the denominator of that fraction, the number of positive tests divided by the number of tests given, that will help us understand whether it's really an up or down. If, for example, if this is a stupid analogy, but if there's 20,000 tests given today and there was 13,000 tests given yesterday, and I have no idea, those numbers might be, tens of thousands off, but that could be the same percentage is what I'm saying. So the numbers in and of themselves, especially when they're coming from, meatpacking companies that maybe aren't doing the best practices, physical distance practices, hell yes, that's a concern. But as it relates to our metrics that we agreed to going forward, we have to keep in mind that that is divided by the number of tests given.
Thank you, Brendan. Now to Ben Meyer from WXPR.
Hi there. This is with WKOW. I just got skipped because of some technical issues. Am I able to come in and do my quick question?
Go ahead.
Sorry about that. So, we have, after this protest is scheduled tomorrow, the request was denied, the application was denied, but they are still planning on going through with this protest. Does the governor have any response to the folks that are still planning on coming out to the Capitol lawn without a permit?
Certainly. I celebrate the First Amendment and celebrate people's ability to exercise it. Just keep safe distance apart.
Thank you. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Thank you. As you know, there are still 5 counties in the state that have not shown a positive COVID-19 test. They're all here in northern Wisconsin. Either for Secretary Palm or Dr. Westergaard, I don't know if he's there. Is it a good bet that all 5 of these counties probably have someone who's COVID positive and just hasn't tested positive yet or hasn't gotten a test?
So I'll start, and then Dr. Westergaard can dig in a little. So I think one of the things that's really important about how we're thinking about our expanded testing capacity and the work we need to do in this space is to make sure that it is more available across the entire state, so that we are getting a better handle on the prevalence of the disease in communities all around the state. And so whether it's our partnership with Exact Sciences or Marshfield or some of the other clinical labs around the state, we want to make sure that the rate at which we're testing in communities all around the state allows us to understand the prevalence of the disease, so that local communities have that sense, understand the kinds of things that we need to be doing together to protect the people who live in those communities as we start to turn the dial and move to a place where there's more active interaction among people. And so part of our strategy as we are expanding our testing capacity is to make sure that we are pushing that capacity into the parts of the state where they have not had as ready access to testing as other parts of the state. And I don't know, Dr. Westergaard, if you want to say
Yeah, this is Ryan Westergaard. I'd say, of course, we can't say anything with certainty because we don't have the data from all the geographic areas. But what we've learned from other studies in other areas of the world and other areas of the country is that it's pretty common to have discovered after the fact that transmission had been occurring in the communities well before the first cases were detected. There was a recent modeling study from California, and there was also one from Washington State that said the date that we identified the first case through testing likely occurred after there had already been disease transmission in the community. And they know that by looking at a number of the genetic sequence of a number of other viruses that were diagnosed afterwards, and concluded that there had been sort of mixing and viral evolution over time. So we know that it's possible that the virus can be spreading silently before cases are detected. So that helps us really think about why the statewide strategy is necessary.
Thank you, Ben. Now to Will Cushman from WisContext. Will?
Hi there. My question is for Secretary Palm or Dr. Westergaard. It's a clarification question. I'm still a little confused about the parameter for in the Badger bounce back related to a downward trajectory in newly confirmed cases. Is that a downward trajectory? Is that like the proportion of positive cases to total tests conducted each day, or is it an ongoing total?
Sure. There's a lot of different kinds of parameters that you can use to determine whether an epidemic is growing, staying the same, or getting better. And so the plan looks at a few things from three different sources, including syndromic surveillance and numbers of symptoms. With the specific piece about the percent positive case, or the proportion of positive cases, was something the governor was alluding to earlier. As a proportion of the number of positive cases, we want to see that as a proportion of the number of total cases, the number of positive cases is getting down. So there's two ways that would happen. One is that we're testing a lot more people and the incidence and prevalence are staying the same, or that the true number of new cases is going down. So right now our percent positive cases has been hovering between 10 to 12%. That's the number that we want to see gradually going down. So we want to see a day-by-day increase in that number, that percent positive over 2 weeks, before we feel like we're clearly going in the right direction. So that's the idea with that gating criteria.
Thank you, Will.
And that's the daily proportion.
Will, I'm
correct?
sorry, one question. We'll move on to Todd Richmond from the Associated Press. Todd? Todd Richmond?
Hi, can you hear me?
Yes, we
Can
can.
you hear me?
Yes.
This question is for the governor. How do you respond to all the people contacting your office with complaints about the extension? Some of them are pretty bitter. Some of them are pretty desperate. How are you responding to them, if you are at all?
Of course, we respond to requests or to questions and comments. We also respond to the thousands of people that send us things saying this is something we're real comfortable with. Clearly, there are people in Wisconsin that are struggling because of this disease, and we believe that the best way to move the state forward is to attack the disease, attack the virus. While we're doing that, we are also looking for every flexibility we can find to dial back things that may be restricted businesses from opening or expanding. People need to realize that if you look at the number of essential services that exist in the state and that people are working in, is huge. It's much larger than most states in the nation. So we feel proud about that, and that's working. But there's no question, especially in the service sector, especially in small businesses, people are struggling. That's why we fought hard to make sure that people get the resources they need through workers' comp insurance, but also, unemployment insurance. But also we are doing whatever we can to make sure that we are in a place so that we can start to reopen different parts of our economy, and we will continue to do that during this time, up and through May 26th, if there's an opportunity to do something before. So yes, we also spend time, Todd, is working with our federal officials, finding resources for small business people so that they not only can begin to have the resources they need to survive, but also have the resources they need to create the supply chain they may need when they are going back into business. Of course, it's a significant drain on the entire country. We are not alone in that in Wisconsin, as you know, and we're doing everything we can to make sure that people are held whole if possible, and to have this disease be defeated or at least minimized as soon as possible, so that we can open up the state in a thoughtful and cautious way.
Thank you, Todd. Now to Hillary Kay from WWIB Radio in Chippewa Falls. Hillary?
Yes, this question is for the governor. Earlier this week, Assembly Speaker Robin Vos claimed that you have not had conversations with the legislator about decisions made during the pandemic since initial discussions about the election. Instead, they're claiming you've just unilaterally made decisions. So what do you say to that? And do you see the value of having discussions with the Republicans in regards to reopening the state?
Well, that's an interesting comment. I think our staff members talk to their staff members every single day. And I have on occasion talked to Speaker Voss about this issue, but the fact of the matter is, I haven't seen the Republicans come to the, it took them a month or 3 weeks, several weeks before they had their plan to bring to the legislature. So, I'm not going to involve myself in a back and forth on this. The bottom line is he and the legislative Republicans have decided to take this to the Supreme Court. And that's nothing more than a blanket, obvious power grab, which I reject. We hope that the state Supreme Court hears our argument, which I think will be prevailing, and we can move forward. We're going to move forward. We're moving forward in the meantime anyway. So, going back and forth with what Robin Voss at this point in time is not necessarily helpful. Our staff and his staff, if it's not every day, it's damn near every single day they talk.
Thank you, Hillary. Now to Steve Prestegard from the Platteville Journal. Steve? And a reminder, *6 to unmute your phone. Steve Prestegard from the Platteville Journal. Okay, we'll move on to Addie Bink from WFRV TV in Green Bay. Addie?
Hi, I was just wondering if maybe Secretary Powell, this would be for you, but if you would kind of explain how the state is involved in the outbreak that we're seeing up here in Brown County. Just wondering if DHS officials are up here trying to help out at all, if DHS would kind of make a final decision on whether facilities could close up here.
Mm-hmm. So we've been in very close contact with both the local public health department as well as the health systems involved in helping to do the testing that's going on among employees and family members of some of those work sites up there. We did not, as we have in other current situations, sent National Guard resources. What the request from the locals was to send some testing supplies, which we did. We sent over 2,000 test kits to Bellin to be used again to test workers, employees, and family members as they try to get a handle, as they try to get a sense of the size of that outbreak. So again, you can take that information and do the contact tracing that is necessary to get your arms around that outbreak and stop the spread. We also did facilitate a connection to the Centers for Disease Control, who do have a few resources on the ground to help with some of the data analytics, as well as some of the needed contact tracing. They're supplementing that local staff on those efforts, and so I think it's an important question in that it illustrates how we're thinking about our partnerships with local communities and where they've needed staffing resources, and we've been able to use National Guard units. We have done that where that has been what would be helpful to them. In this case, it was testing supplies, which we provided, et cetera. And so I think it speaks to the way we are thinking about being efficient with our resources, being good partners with our local communities, and wrapping around and supplementing the kinds of gaps that they may have in any particular situation, so that together we're doing what we need to do to protect communities all around the state.
Thank you, Addie. Now to Dylan Brogan from Isthmus. Dylan?
Hi, yes. I was hoping that you could talk more about contact tracers and how many have been hired. Are they working for local health departments or the state? And who's qualified to do this kind of work? And is there going to be a problem filling this ever-increasing position?
Mm-hmm. So we have put into circulation just about 150 contact tracers and have more in the pipeline. They have been provided some training by us to make sure that they are prepared to do the work that they need to do, and we have certainly modified that training over time as we have learned more about the complexities of the kinds of questions and interactions that these individual contact tracers are having with positive cases and with the context that they are notifying as potentially exposed to the virus. And we are currently actively working through our planning process around Badger Bounce Back to think about how to scale up this workforce in an efficient and high quality way, to your point, to make sure that the folks who are doing this work are doing it to the best of our ability to meet the needs of local communities. I don't know, Ryan, if you want to say.
Yeah, I'd elaborate just a bit that the activities to date have really been one of surge capacity for the purpose of making the phone calls that are necessary to track down these contacts. You know, in the next phase, when we really try to get back toward a position of containing individual cases and really trying to get to 100% successful contact and supporting people for isolation and quarantine, we think it's going to take a larger and a different kind of workforce. Hopefully that really leverages the community resources, so people who work in the communities have trust and rapport with the communities where cases are really in the best position to do that work. And the next phase of building our contact tracing strategy is going to look at a whole range of trying to engage local partners to do the work, in addition to the central coordinating factor, coordination that the state can do in terms of wrangling the data and keeping track of all the cases as they come in. We're going to really rely on really indigenous health workers who are in communities and have established relationships, because as the Secretary was mentioning in the comment, this is really something that requires a lot of civic participation, and people that can establish trust and do these kinds of, have these conversations in a sensitive and a responsible and a confidential way is really important. So that being said, it's a skill set, but there's a lot of people in our community-based organizations who do this work already in all ranges of social services. So I think the workforce out there is sufficient. We just need to engage them and train them in our specific public health reporting practices. And so it's a large effort, but we've got a good planning process underway to do that.
Thank you, Dylan. Now to Casey Cronus from Fox 6 in Milwaukee. Casey?
Hi, thank you for taking this call. This question is for Governor Evers. As a station, we've gotten hundreds of calls and emails from viewers who still have not gotten their unemployment money. We spoke with one woman today who says she's now struggling to pay her rent and to pay her bills. What would you say to those people who are being persistent, trying to get in touch with someone at the office, but are just not able to get answers? And what is the state doing to help them?
Well, first of all, and thanks for the question. We have successfully, got unemployment insurance to thousands, tens of thousands of people already. But that doesn't excuse the fact that we have others that have made that application and are waiting for the first check or waiting for some answers. And we are expanding our workforce on a daily basis. We initially were using people within the Department of Workforce Development, and now we're reaching out to hire people to be more efficient and process those claims easier. And just to put it in a little bit of context here, what happens on the phone in interaction with people is just half of the job. For processing those claims after the conversation is done takes as long as it does. So the hours that is open, and we've expanded those. We additionally have work to do to process those claims. So it's a two-step process, but to answer your question directly, we're hiring more people so that we can then process them in a more timely fashion.
Thank you. Excuse me. Thank you, Casey. Now to Dan Malloy at Spectrum News 1. Dan? Spectrum News? Okay, we'll move on then to Tim Stum from Wisconsin Health News. Tim?
Hi, thanks for taking the call. Has the state or does the state plan to issue any guidance on when and how hospitals can start ramping up some of their elective and deferred procedures? Or is this something that is just up to the hospital to decide when they think they're ready?
Mm-hmm. Thanks, Tim. I'll let Dr. Westergaard dig in a little, but I think, on the front end of this, we did not, as part of any of our orders, require hospitals to stop elective procedures, or and so they all assessed where they were. They thought about their surge plans. They worked through those details at the local level, and certainly made decisions based on that, and made calculations about the kind of care they were going to need to defer moving forward. And so I think we are actively engaged with them in conversations about how to be good partners with them. Again, right, these PPE issues are things that they are struggling with as they think about starting electives up again, and it is a focus for us to try to bring into the state of Wisconsin the needed PPE, not only to treat COVID, but also, again, to get to a place where our local health care and hospital systems can do more of this deferred care, because that is critical to the overall health and well-being of this state as well.
Yeah, nothing to add.
Yeah. All right. Thank you, Tim. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks for taking the call. In New York, they're doing antibody testing. 21% of residents have tested positive for COVID antibodies. A lot of them haven't tested positive or for the virus, excuse me. But is there a possibility of doing a large-scale antibody testing or something like that here in Wisconsin?
Yeah, Ryan Westergaard, I can take that. It's an important topic, and there's a lot of interest in the idea that we can understand who's been infected with antibody tests. The science is catching up to the promise. As of right now, there's a large number of products that can detect antibodies, but not very well, and they haven't been approved. The more highly reliable tests are starting to become available. And when they are, I think the biggest use for them is going to be for epidemiology, to understand that question, how many people have been infected. In the state, we're interested in doing this on a survey basis to really understand it on a population level. The important thing about antibodies is at this time, they're not useful for making a diagnosis. We need to use tests that specifically detect the virus itself, not antibodies to the test. And there's still questions about precision, about cross-reacting with other viruses that cause the common cold. So there's a lot of caveats right now, but there's a lot of promise that's going to help us really understand this size and spread of the epidemic down the road. So we're actively planning it, but the technology isn't at a state right now where it would be highly useful information, but it's something we're working toward.
Thank you, Casey. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, thanks for this call. Regarding the rally tomorrow at the Capitol, I'm wondering if Capitol Police will be enforcing any social distancing rules, and also whether DHS will be doing any kind of tracking about whether the crowd that gathers there leads to an increase in cases.
We're making the assumption that these are all good Wisconsinites that are practicing their or establishing their right to, under the First Amendment, to express their views, and we also believe that they will make sure that they're physically distant to each other. I don't think you'll see the Capitol Police out there or other law officers out there with measuring with a yardstick, seeing if people are too close or too far away. At the end of the day, people make those decisions, and I think it would be a mistake to make the decision to not comply or not use good judgment by keeping safe distance from someone else. You may feel that that's not an issue for you, but for others it might be an issue, and that you're not doing that. Being at a safe distance could negatively affect someone else. So it's not necessarily the expression of using the First Amendment to express yourself, to voice your opinion is quite sacred, but I don't think that should prevent people from using common sense.
Thank you, Molly. Now to WISC TV in Madison. WISC. WISC? Okay, we'll move on then to Laurel White from Wisconsin Public Radio. Laurel? And a reminder, *6 to...
Hi.
Go ahead.
Hi, thanks for taking my question. I'm just curious about testing capacity. I know that obviously it's been a challenge to ramp up testing. Do you have any sort of projections on when
You guys, can you hear me?
might meet that?
Stand by, please. Someone is asking a question. Go ahead, Laurel.
Yeah, I was just curious about when you thought the threshold might be met for meeting the Badger Bounce Back plan for testing.
Mm-hmm. So Laura, that's a great question. I appreciate the ability to provide a little bit of clarification. So we set this goal of 85,000 tests a week, which is about 12,000 tests a day. Today we are, I think, just over 10,000. Yes, I'm looking at my cheat sheet. Just shy of 11,000 tests capacity today. So we're making significant progress towards our goal, and that is certainly something we are pleased with. But I think we will be better informed about whether 85,000 a week is enough as we understand more closely the prevalence of the disease in this state. But unlike the gating criteria, the trajectory on cases, symptoms, and healthcare hospital capacity, our progress, we were very clear in the order and in Badger Bounce Back that these other capabilities, this infrastructure that we're building, that we want to make significant progress towards those goals, but that the important gating criteria, the important criteria as it relates to starting to turn the dial, are on these trajectory measures. And if we get there, we certainly are still not at 85,000 a week or at 1,000 contact tracers, for example, we would balance that all together and did provide ourselves the flexibility within the order to continue to move forward as the data tells us we need to. So 85,000 is our goal. We will continue to expand our capacity, likely well beyond 85 if we're able, but that is not a rate limiting factor as we think about turning the dial on Safer at Home.
Thank you, Laurel. I believe that was WISC who came on, WISC TV in Madison. And a reminder, *6 to unmute your phones. WISC?
Yes, can you guys hear me?
Yep. Go ahead, please.
Hi, sorry about that. I was watching on the YouTube stream, and I think there's a bit of a delay. My question is about the increase in testing across the state of Wisconsin. Do you expect to see higher numbers of confirmed cases because now there are more tests available? And I guess, if so, how do you navigate kind of knowing where we are in terms of the curve, if there is an increase in tests because just the fact that there's more cases more test kits available?
Mm-hmm. Yeah, we certainly do expect to find more positive cases, just like we expect to find more negative results the more testing we put out into the community. But it's a critical part of understanding the prevalence of the disease and being able to wrap the contact tracing resources around those positive cases and potentially exposed contacts to do the work we need to do as we turn the dial on Safer at Home. It is also part of why the criteria or the gating metrics around 14 days of symptoms, cases, and symptoms and cases are thinking about this as a % of the total number of tests, so that you can smooth out some of those bumps, but also to think about it in a trajectory over time kind of way, so that we can account for, for example, this in Brown County, as we have surged a bunch of tests up there, we expect to see a bunch of positive results. And so how you factor that into to your trends is an important thing, an important thing you need to do some control for, so that you've got a trajectory that is taking into account all of those factors. But I don't know if you want to say anything more about that.
I think emphasize that it's such an epidemic is such a complex phenomenon. You have to look at it from multiple different perspectives to get a clear picture. And so we use different metrics to look at different perspectives. So the number of tests is one, the number of cases is one. As we talked about, the percentage of tests that are positive is another one. And then we also look at hospitalizations and deaths, which, assuming that we're having more complete testing of critically ill hospitalized patients, that's going to be less sensitive to changes in overall testing. So we look at all these different parameters simultaneously to get a good picture of the way the epidemic is going.
Thank you. Now to Cammie Rapson from WBAY TV in Green Bay. Cammie?
Hi there. This is for the governor. Brown County has 500 positive cases, 265 of which are linked to meat processing plants here in the county. Today, Brown County Health said that closing down these plants is not on the table on their end. Would the state step in and make those decisions regarding those plants?
Well, can you help me with that? I just don't know I don't know the answer to that one.
Yeah, so we have been working closely with the hospitals and with the local public health and in contact with those employers as well. I think we are trying to balance all of these factors as we understand the prevalence and the outbreak there. I do think, I don't want to. There's some talk about whether there is supply chain issues there that would result in there not being actual work to be done, at least at one of the facilities. But I don't know, Ryan, if you have more details on that.
I think it's an evolving situation. We have to, work in close partnership with the facilities, the local public health to do the right thing. I think we're still working on exactly the best strategy.
Yeah, and I'll just, whether they're closed or not, I cannot answer that question, but I can answer this one, or offer this solution, is that if this outbreak is a result of not enough physical distance between workers, that's a problem. It has to be fixed.
Thank you for that, Cammie. Now to Nick Borre from WISN TV in Milwaukee. Nick?
Hi, Governor. Can you talk about, on the Badger bounce back, you talked about having a 14-day period, obviously. If there is a day in day 10, for instance, where there's an increase, but otherwise it's a general downward trend, is that what you're talking about, or does that reset the clock if there's one day in that period?
We'll take a look at that. I suppose that question could be if there's a increase one day and not the next, and then increase. We need to see 14 consecutive days. That is very important. But if there's reason to believe that one day was an anomaly, I guess we could take a look at that.
Thank you, Nick. Now to Brem Sybil-Smith from Wisconsin Watch. Brem?
Hey, no questions today. Thanks for keeping this communication line open.
Thank you, Brem. Now to Morgan Wolf from NBC 15 in Madison. Morgan?
Hi.
Hi.
Can you hear me?
Yep.
All
Yes.
right. I have a question regarding the schools. So the phase one of the Bounce Back program includes reopening the schools, and we've heard of teachers in our area telling parents to prepare to do virtual learning for the next school year. So my question is directly to Governor Evers. As a former educator yourself, do you feel comfortable sending teachers and students back to school without a vaccine?
Well, it's our hope that school will open this fall. And if we do the right things, we will be in a position that the number of viruses floating around this state are a small enough number that we can deal with them individually. So at this point in time, that's our hope. I suppose there's a possibility that if we rush into things and don't do things slowly and with thoughtfulness, that we are still talking about this very thing next fall. And I suppose that is a possibility. That's why our bounce back plan is set up to do just that. We want to get this virus. We're 24/7 on this. we want to get this virus to a point where we're not boxing in or we're not boxing in our society, we're boxing in the virus. And if we can get to that point, even though that virus is not gone, we are able to deal with it in a much more reasonable way. One person, contact tracing, take care of that person and the people that they have had contact with, and that's a scenario that's doable. So that's why we're doing exactly what we're doing, so that we're in a position to open up next fall. But as everything else is, it's an evolving situation. So you never say never, but the plan is very simple. We're going to be doing a lot more testing. We're going to do a lot more contact tracing. Make sure we have the equipment, and that includes the schools for this next fall. And by doing that, we will be able to start slowly building back our economy in a thoughtful way, and then and deal with individuals that have the virus rather than masses of individuals. We can do this, but you always have to have a plan B or plan C out there.
Thank you, Morgan. Now to Abigail Huntkey from NBC 26 in Green Bay. Abigail?
Hi, thank you for taking my question. I guess just for Governor Evers, a lot of people are trying to find creative ways under the Safer at Home order, especially with the extension, to celebrate birthdays or anniversaries. And I know one of those ways is to do a drive-by parade. However, I've seen on social media a health department saying that under the order this is not technically allowed, and are asking people to kind of find other ways to celebrate. I'm wondering what your thoughts are about this as people try to kind of mentally cope without these celebrations.
I'm going to have to say I didn't hear what's the platform that is being used?
A drive-by parade.
Oh, drive-by parade. Okay.
Correct.
Well, I thought it was some high-tech thing. It's a drive-by parade. I would say, I've seen it done. People are keeping their distances. I'm guessing for the most part, it's going to be more difficult for people to keep their distances, the more cars, the more people, and so on and so forth. So I'm not going to sit here and say don't do it, but I will say there are likely better ways to do it that people can be assured that their distancing is appropriate.
Thank you, Abigail. Now to Katie Crowther from TMJ4 in Milwaukee. Katie.
Hi, you guys answered my question. Thanks so much.
Okay, thank you. Now to Eric Gunn from Wisconsin Examiner. Eric? Eric Gunn.
Hi, thank you for taking my question. We continue to hear reports from people who say they've been discouraged by their providers from getting tests for COVID-19 despite having symptoms. And I'm wondering if the word is getting out to providers who need to hear it, that the state has expanded and is continuing to expand the criteria for who gets tested. And if that word isn't getting out, what needs to be done about that?
Well, Eric, you're giving us that opportunity right now. So we have expanded the testing guidelines. We are encouraging providers to test anyone with symptoms, and we do have the testing capacity to allow that to be the case. And also as part of our testing strategy, we are surging resources, including testing supplies, to make sure that we are getting those kinds of capacities, the kinds of resources that communities need to do the testing that is necessary to understand the prevalence of the disease all around this state. I don't know, Ryan, if you want to say anything about the avenues we've
Right,
used.
we're trying a lot of different ways, and I'm as a physician, I'm probably guilty of this too, of being hard to reach by email, and so we're doing a weekly webinar where we try to reached over 1,000 physicians or and other healthcare providers. We're getting this message out. We've established something called the Health Alert Network, where any healthcare provider can register with their preferred email address and get things directly from us for timely and urgent things. So we're trying to push out these multiple channels of communication, and through the media seems to be another useful one. But the message is that right now, at least laboratory capacity is sufficient to test anyone with symptoms. It's not the same thing because there can be local variations in the ability of testing swabs and kits and PPE. And the other thing to realize is that a lot of healthcare is being done virtually right now. Most outpatient clinics have very low volume, and now that influenza season has passed, there aren't as many people going to clinics with symptoms. So there's a lot of reasons that I think that the overall number of testing is low, but part of the message to the whole healthcare sector is that we can and should test people more liberally than we have in the past, and also in our next couple phases where we really try to, as the governor was saying, move into the next phase where we're really trying to contain it well. We need those data. We need to test widespread, even if it doesn't necessarily change the management of the patient, meaning we test for influenza because we have influenza medications and that can help us know how to treat the patient. So our paradigm needs to shift a little bit so we can test people because it's important for the public health to know whether they're a case, and then we can trigger the contact tracing and quarantine and isolation that's really going to be required to contain it. So testing plays a central role in our whole public health response, and the healthcare system is going to need to play a slightly different and more expanded role in finding cases than we do with a lot of other conditions, because traditionally we do testing when it's helpful for the patient, and that's how we make the decision. But they're going to be really community-wide and public health levels that we do testing in a broad fashion across multiple healthcare settings going forward for the next year at least.
Thank you, Eric. Now to Jonah Chester from WORT Radio in Madison. Jonah?
Hi, thank you for taking my question. Governor, you mentioned a minute ago that resources are being made available for small businesses. But specifically, what measures are being taken to provide financial support to those same small businesses during the Safer at Home order?
Well, certainly the Wisconsin Economic Development Corporation initially had resources available, and that fund has been depleted. I was speaking prospectively, I believe, and that is because the federal government just passed another multi-billion-dollar bill that will help states to help small business owners not only kind of survive in this time, but also prepare for the day when they're able to open up and kind of reinvigorate their supply chains and things like that.
Thank you for that. Now to Robert Chappell from Madison 365. Robert? Robert from Madison 365. And a reminder, *6 to unmute your phone. Okay, we'll move on then to Caitlin Farrell from the Cap Times. Caitlin?
Hi, yes. I'm wondering, is the state tracking and going to post on the DHS website the number of tests actually processed, like Secretary Palm had mentioned? That 10,000 number on a weekly or daily basis so that the public can monitor how close the state is getting to the number needed to fully reopen the state and better see that rate at which we're testing over time?
Yeah, absolutely. We will. We are working on and have started to put up some information as it relates to some of these gating metrics, but absolutely we will be putting up a daily track of our testing capacity and of the number of tests that we are able to do on a daily basis. So stay tuned, but that is coming very soon.
Thank you, Caitlin. Now to West Politics and Stephanie Hoff. Stephanie? Stephanie Hoff.
Hi, can you hear me okay?
Yes, we can.
My question is for Governor Evers. What are you going to do for farmers affected by the pandemic? I understand that 8 farm groups recently sent you a letter asking for some relief.
Right, and we plan to propose that to our Republican friends and see if we can do something about that. We tried to do that in the past and it did not work. So we will continue to do that, and I know the federal government is stepping up to some extent. They're buying products that they to make the market stronger, and moving those products to food banks, which should have been done at a much higher level and much sooner. But it's a start. Plus, they've also indicated money for the agriculture industry. So I agree with those those organizations, and we hope to have a proposal that we can get our Republican friends to agree to.
Thank you, Stephanie. To Jeremy Janine now from Urban Milwaukee. Jeremy?
For Secretary Designee Palm, question on clarifying the 10,937 testing capacity number. Is that per day, meaning the state would have 0 the next day if all those were used? Or is that a per week figure? How does that number work?
So it's a great question. So we do, we track very closely with our clinical lab partners what their capacity on a daily basis is, which is why that number fluctuates. And part of what we take into account in that number is, labs across the state continue to come online with testing capacity, but we also are very closely tracking some of these supply chain issues, whether it's reagents, whether it's cartridges for a particular platform, et cetera. There are a variety of issues in the supply chain. And so our number tracks daily capacity, but it also is looking at future potential shortages of supplies so that we can adjust that number on a daily basis to reflect that. So the number you hear is the actual number of tests available, and we're tracking this in a number of ways so that that daily number is accurate about that particular day.
Thank you, Robert. We had a couple of people we called on who didn't get a chance to ask a question, so we'll try again with Dan Malloy from Spectrum News 1. Dan? With a reminder to press *6 to unmute your phone. Dan Malloy from Spectrum News 1. Okay, and our final question then belongs to Steve Prestegard from the Platteville Journal. Steve?
Can you hear me now?
Yes, we can. Thank you.
Okay, thank you. I think this is a question for Secretary Palm. The counties that we cover have been giving us very different information about about the identity of the people who have been diagnosed positive. And I understand what HIPAA is, but there are some counties who are saying, well, we have a person. There are some counties that are saying that this is a person in a certain age range and so on. Has the department given county health departments any kind of guidance as to how much identification they're allowed to give of people who have been diagnosed positive?
Mm-hmm. So we have not interfered with local public health departments' ability to provide the kind of information that advances the public health. And so I do think from the perspective of your question, things that local public health are considering are the size of their county, of their community. So the more information you give, the more likely that person is to be identifiable versus a place where there is a much larger population. And so gender or other race, ethnicity, other things are less likely to identify individuals. But we also at the state level, through our website, have tried to, now that our numbers are larger, have tried to provide additional demographic information so that folks have a better sense of what the statewide epidemic looks like in ways that advance the public health and don't potentially implicate people's personal privacy.
Thank you for that, and thank you for joining today's media briefing. Please continue to monitor the DHS outbreaks and investigations and COVID-19 web pages for information, data, and guidance. For topics not related to public health, you can visit the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, and Wisconsin Economic Development Corporation. And you can join Secretary-Designee Palm and WEDC Secretary-Designee and CEO Missy Hughes for Facebook Live coming up at 3:15. Thank you, and have a good afternoon.